Are you looking to start a new physical activity in the new year and wondering how you can prevent knee injuries before they happen? Well, then you're in the right place. Today we're talking about the most common sports to be starting this time of year and what you need to be doing to prevent knee injuries. I'm going to go through different activities including walking and running and even pickleball, which is like the fastest growing sport in the United States, and what you can do before you start or while you're starting that'll make a big difference in preventing knee injuries in the first place. Also, if you have any activities that you're like, hey, I want to start doing this and I'm wondering what I can do to prevent knee injuries, drop them below and we'll make another video just for you. All right, here we go. So first we're going to start with walking, which is where I recommend a lot of people start. If you haven't been active for a while, maybe a past year or two, or maybe, since the beginning of COVID, you didn't really keep up with your exercise routine, walking is a great place to start. It's really, really good for your cardiovascular system. It's really good just to get that blood pumping. You can do it outside and get some deep breathing and some nature. You can do it on a treadmill. You still get the same health benefits. You don't get to be obviously in the nature as much, but that's all right. If that works better for you and where you are in your climate, then that's fine. Treadmills are not a problem at all. I definitely like starting with walking because it's very good to do for everybody. Usually it's safe for almost everybody. There's a low barrier to entry. What I mean by that is that with walking, really the biggest thing you need to do is make sure you have a good pair of shoes. And I'm not talking about that old pair of tennis shoes that's been sitting on your closet floor for the past 5 years. If you are very intentional about starting a walking program and you want to start increasing your distance, I need you to hit the store. You can order them online if you prefer, that's fine. And I need you to find a really good pair of walking shoes. Now, walking shoes are different than running shoes, so I definitely do recommend a good pair of walking shoes. If you live near a trail and you're gonna be walking on a trail a lot, some people do like trail shoes. Personally, I'm not as big of a fan of trail shoes unless that's what you're gonna be walking on all the time. I feel like it's really hard walking in trail shoes on concrete or on asphalt. So I definitely, if you're going to be on trails 100% of the time, then I would recommend trail shoes. If not, if there's going to be either trails and concrete asphalt or just concrete asphalt, then I definitely recommend a good pair of walking shoes. It's really important to invest in that. That is the one barrier to entry, I admit, but it is really important to invest in a good pair of walking shoes, especially if you want to prevent knee injuries in the future. The next thing is you definitely want to avoid concrete as much as you can. Now, this can be challenging depending on where you live and the availability of trails or safe asphalt to walk on. I live in a neighborhood that doesn't have sidewalks, but it does have really wide shoulders, so the asphalt is very easy to run on. There's lots of room and it's well away from the cars. So it's very easy for me, but usually if I am gonna go for a long run, I will get to a trail to make sure that I'm on a softer surface that decreases the impact to my knees. Same thing will be said if you use a treadmill. So if you're on a treadmill, it kind of has that little bit of bounce and helps to absorb some of that force. So definitely much softer on your knees. If you've had knee problems before, I definitely recommend starting on a treadmill or on a trail on that softer surface. You could also, if there's a school nearby, you could run on the track, depending on walk on the track. Let's start again. If there's a school nearby, you can walk on the track. I understand that as your distance increases, that probably won't be what you want to do because that gets a little boring over time. But while you're starting to work up on your distance, it's a nice soft surface for your knees while you're doing it. One thing I need you to avoid is walking on concrete for long periods of time. Concrete is super hard, and even if you have really good shoes that have really good cushioning and really good shock absorption, you are definitely going to have that impact from that concrete. So I need you to find a route that has a minimum amount of concrete. So asphalt's not as bad, trails better. Obviously treadmill, if you're running inside on the treadmill, you don't have to worry about that at all because obviously you're not going to be exposed to it. The other thing that is concerning about concrete is if you live in a neighborhood where the sidewalks obviously are concrete and they have the driveways, you're going to have constantly 1 foot lower than the other when you're on the driveway, right? Because they kind of slope down. If you need to do that for a period of time until you can get to the asphalt or the trail or whatever, make sure that you walk on the same side of the sidewalk while you're going out and when you're coming back. That way the other leg gets a chance to be on that downhill slope. Helps to kind of balance things out. Not ideal, but that's how we can make some compensations if we need to. Now, when you're starting a walking program, you have a goal in mind. You may want to walk for 3 miles or 5 miles or 7 miles. And that is absolutely fantastic. But that's not where you're going to start if you have not been walking frequently recently. So if in the past 6 to 12 months you have not gone for walks regularly, then I need you to start at a shorter distance and work up to that longer distance. So if you haven't walked, let's say in the past year at all, I want you to start with either half a mile or a mile, depending on your fitness level. Maybe if you've done something else for the past year, you've been doing yoga or Pilates or something that's a little bit less cardio overall, but you're still been very active, you can start with a mile. But if you've been more sedentary for the past year, then I want you to just start with a half mile. We want to make sure that we have really good success, that we're not too sore the next day so we can go back out again, and that we're not struggling with any injuries right at the beginning. Obviously, if you start any new program and you start getting injuries right in the beginning, you get shin splints or knee pain or ankle pain or something like that, it's really demotivating. So let's start with something that we know we can be successful with and then build from there. What I want to see is I want to see you do 3 to 4 walks per week, and I want you to do the same distance 3 to 4 times, so like 1 week's worth of walking before you increase the distance. And then again, I want you to do that 3 to 4 times before you increase the distance again. Now, if you have been sedentary for the past year, you only want to increase by a 1/4 mile. If you have been active for the past year, you just haven't been walking, then you can increase by half a mile. But as always, please listen to your body. You want to do what your body is okay with and what your body feels comfortable with. I'm okay with a little soreness afterwards. You should definitely implement a stretching program when you start walking. And we've got lots of programs here on this YouTube channel, so check those out. We'll link them in the video description. Check those out and find one that works for you. Definitely make sure you are stretching because soreness is normal. That means we're using the muscles. That's okay. Pain is not. So if you feel any pain, really try to think about, is it equal on both sides? Because that may just be the muscle soreness. Does it go away within 48 to 72 hours? Then you just need to give yourself a little bit longer to rest. And does it really impede how you're walking later on? So here's the thing. If you go for, let's say, a mile walk and the next day you're kind of limpy because you've got some knee pain or ankle pain or something like that, well, now that's affecting how you're walking just for your regular daily activities. Now, that alone can lead to an injury. So we need to work on that distance. We need to make sure we're stretching, use ice for pain, all that good stuff to make sure that you are not having any problems in the long term, because we want you to have success at the beginning and all the way through until you hit your goal. All right. Next up is running. So if you have a running goal in mind for 2023, then this is what we want you to start with. First thing is you need to get some good shoes. I cannot emphasize enough the importance of good shoes in shock absorption and decreasing your knee pain. How do you know if your shoes are good? Well, you can definitely check the sole and do the twist test. We have a video about that here on the YouTube channel. We'll link that one below. But you can also make sure that A, it's fairly new, and B, it doesn't have more than 300 miles on it. So I'm pretty sure if you have that old pair of running shoes that's been in your closet for 5 to 10 years, those are probably not going to be your running shoes. You probably need to find a new pair. And I know it's difficult to find a good pair of running shoes, and if you're just starting out running, you may not even know exactly what you're looking for. In that case, I recommend that you go to a running store and you tell them what you know about your body. If you've ever tried running before and you ran into any problems, talk to them about that. If you're just starting a running program, talk to them about that. They can analyze your gait and help you to pick the best running shoe for you. Now, to be fair, is that shoe going to work for you for the long term? You never know, but you got to give it a shot and get some runs on it, and then you can go back and give them more feedback. I will say, when I first found my running shoes, it took me probably 3 or 4 pairs until I found the pair that was really going to work for me. And that shoe I've been able to stay in even as they change models for the past 8 years. That's not true for everybody, because as they change models, sometimes people start to feel that the changes they've made haven't worked for them, and I totally understand that too. But then again, a good running store can help you with that. You can say, hey, I had a lot of success with this one, I'm not having success with this one, what do you recommend from there? And they can help guide you in your running shoe decision. You can also try ordering them from online if you feel like you have a pretty good grasp on where your problem areas are and what you're looking for. But do be careful with that. If you do that, I recommend ordering from somewhere where they have free returns as well. I'd order several pairs of shoes, try them on around the house, and see which one feels like you have the most support in your foot. You don't want your foot sliding around in the shoe, and you want to make sure that it feels like you've got that good cushioning where you hit. So if you're a heel striker, you want to make sure you got good cushioning in the heel. If you're a midfoot striker, you want to make sure you have good cushioning in the midfoot. Now, I'm going to talk about Hokas here because Hokas have become kind of more of a recent craze. I guess they're kind of, you know, in that in-between area now, but a lot of people really love them for running, and a lot of people really hate them for running. And what I can tell you with Hokas is you'll fall into one of the groups. Either you'll love it or you'll hate it. I don't know anybody who feels neutral about Hokas. If you're interested in trying them, I would definitely go to a store, try on a pair, walk around with them. Most running stores, you can go, you know, run out front for just a lap just to kind of see how things feel. Personally, I don't like the really cushy heel. It's too much for me. I also do a lot of trail running, so I don't want anything that's that thick. So that's just my personal preference. However, with people who do have knee pain, who are trying to get into a running program, they have had a lot of success with Hokas. So if you have a previous issue with knee pain and you're trying to get into a running program, Hokas may be something that may be helpful for you to try. So just a little side note on shoes, but definitely work with an expert to make sure that you're finding the right shoe for you, because that is going to be critical for your long-term success. All right, for my runners, the thing that I really, really want you to work on, obviously you need to be stretching. I hope you know that. Hope you've checked out our stretching program. You definitely need to be stretching, but you need to be strengthening, especially your glutes, but also your quads. We've got to make sure those glutes are nice and strong. I have literally seen people on the trail who are running who are not activating their glutes at all, and it puts a lot of strain through your knees. That will cause a knee injury in the long term. If nothing other than osteoarthritis, it will lead to that, because that's a lot of compression through your knees when your glutes are not strong enough. Again, we've got some videos here about glute strengthening. Definitely check those out. Start yourself on a program. You need to be doing that every day if you're starting a running program, because we've got to make sure that those glutes are engaged to take stress off the knee. For my runners, I'm going to tell you what I told my walkers. I need you to avoid concrete as much as possible. especially when you're running. You need to be on a minimum asphalt, if not a trail or even a treadmill. If you like running on a treadmill, those are great because they are that shock absorption, and it makes it a lot easier, a lot less stress on your knees. But a trail will work. You can run on a track if you have one nearby. And even asphalt is better than concrete. So I really learned this lesson a couple months ago. I had 3 conferences within a 4-weekend span of time. So all of my long runs were done on concrete, because if you're staying in a hotel, right, there's only concrete around. Like, you can't, the asphalt just doesn't work. Whereas I usually run on asphalt at home. So I was definitely on concrete a lot more. And as soon as I got back from the last conference, I started having a bunch of knee pain, and I had to work on my stretching and all of my glute strengthening and do more trail running and really take care of my knees so it didn't progress to anything worse than that. So definitely I need you to avoid concrete as much as possible. If you are going to be on concrete or even on asphalt on the side of the road, I need you to run on the same side of the road when you're running out as when you're running back. Because what happens, even on asphalt, you have a cambered road, so all the water runs off to the side, to the gutters, right? So you don't want to be running with the same foot in the gutter this whole entire run, because that will throw your hips off and potentially lead to hip pain or dysfunction. So make sure you're running on the same side of the road, or at least switching sides of the road depending on how busy the area is that you're running in, to make sure that you don't keep that same foot in the gutter. You got to switch which foot is in the gutter. If you can, depending again on where you're running, if you can switch it up during your run, not all the way out one side, all the way back one side. But I know that sometimes that's not possible depending on your environment. But definitely make sure out and back, stay on the same side of the road so you switch which foot is in the gutter. If you're just starting a running program and you have not been physically active for the past year, I recommend that you start with a walk-run program. Now, for my friends who are doing this, what you want to do is you want to think about what distance you want to end up with, and then you want to start walking at a reasonable distance to start with. So maybe your goal is to run a half marathon by the end of the year, so 13.1 miles by the end of the year, but you've got lots of time. So you're just going to start walking 2 miles, if that's a reasonable distance for you. Now, I know some people that's going to be a lot, some people that's not going to be enough. Something that you can do that is reasonable for right now, that is not going to cause too much stress through your knees. All right, we want to protect those knees and ankles while we're starting. Once you get up to that base distance, so that's going to be between 2 and 4 miles, then you want to start adding in a little bit of running. So you do 2 minutes of walking, a minute of running, 2 minutes of walking, a minute of running. Then you can flip that around. So you do 1 minute of walking, 2 minutes of running, 1 minute of walking, 2 minutes of running. And then after you get good with that, you've done that for a week and had success with it, which a week in this terms is 3 to 4 walk runs. Then you can start doing the whole run. As you progress the distance, you want to again go back to doing more walking. So we only want to change one variable at a time. So it's either how much we're running or it's what our distance is. If you're increasing your distance, then don't increase how much you're running at the same time. Okay? We only want to switch one variable at a time. That way it's a little bit more scientific, and if you start to have any problems, you know what caused the problem. Oh, it's a problem because I was doing more running, or it's a problem because I increased my distance. Make sure you're doing your glute strengthening and your quad strengthening along the way, because as you increase your distance and how much you're running, you're going to need more and more strength. And now for the fastest growing sport in the United States, pickleball. So many people have started playing pickleball. I love pickleball. I think it is super fun. It's actually something I can do, which I'm not really good at racket sports. So I have definitely enjoyed it. I'm not gonna say I'm good at it, but I definitely have enjoyed it. And here's what I've learned from playing pickleball. First thing is you need to make sure you have the right shoes for the court. So I'll admit it, most of the time when I play pickleball, I wear my running shoes because that's my tennis shoes, that's my activity shoes. I run most of the time, and so that's what I wear. Running shoes have a lot of traction, and on a pickleball court, that can be a problem for your knees. You could plant that foot and go to make a turn. We call that a pivot shift. That can definitely be a problem. So if you're going to be playing pickleball regularly, I need you to get some good court shoes that are going to allow you to have a little bit more flexibility with movement, because that's what pickleball is, right? You're kind of running back, you're running up, you're running side, you're lunging, all of that stuff. You need to make sure that you have the right shoes for the job. Now, if you're playing pickleball regularly, I need you to make sure you have a really good warm-up. So I want you to start doing a little light volley with your partner, and get yourself, just kind of get the whole body warmed up a little bit. Nothing aggressive, no pivot shifts, no big lunges, nothing like that. Just kind of volleying back and forth to get your body warmed up. And after that, I want you to do some dynamic stretching. So getting the upper chest opened up, the arms stretched out, the hips stretched out, the quadriceps, which is the muscle in the front of the leg, the hamstrings, which is the muscle in the back of the leg. Finding some dynamic stretches that you can do to make sure your whole body is warmed up before you get ready for the game. The other thing that you can do to improve your performance at pickleball is to practice the different activities that are pickleball specific. So you've got lunges, you're doing quick runs, right? You're forward, you're backward, there's very short sprints. And there's that pivot shifting where you're planting that foot and then pivoting over it to try to get the ball. So these are things that you can actually practice. I don't recommend practicing them before you're playing a game that you're going to be competitive with, that you're trying to perform at. And also, I don't recommend doing it afterwards, because then your body's tired. So this is what you want to be doing in between games. And it's kind of the same format. I would definitely recommend a light warm-up. So maybe if you're not at the pickleball court, maybe you're doing this at home, then definitely a walk or maybe a little bit of a jog. And then I'd recommend doing your stretching, just like if you were going to play a game. And then practice those motions. So those lunges, those pivot shifts, those kind of sprint forward, sprint backward, side shuffles. All of those things you can practice, which will help get you more functionally stronger, so that will help improve your game. I know that for many of my patients, soccer season is now in full swing, and of course it will continue on for so many people, at least through the summer. So the big thing about soccer is you need to have really strong ankles. If you want to prevent knee pain while playing soccer, your ankles need to be super strong. And I'm sure you can imagine why, because you're not just pivot shifting everywhere where you're planting that foot and turning, you are kicking the ball, right? There's other people's feet in the way, all that kind of stuff. Plus you're on a field which is not necessarily always perfectly level, depending on the quality of your field. So it is super, super important to make sure that you're doing ankle exercises, that your ankles are really strong. You also want to do some exercises to prevent shin splints, to make sure that those are not a problem for you either. And for my soccer friends, we want to make sure that you have really strong quads and really strong glutes and really strong hamstrings. So the quads are the muscles on the front of the leg, glutes are your glutes, your butt muscles, and your hamstrings are the muscles on the back of your leg. This is really important to decrease the stress on your knees when you're doing all the different activities that are involved in soccer. So you want to be doing some squats and some lunges and all those types of exercises to really make sure that those muscles are engaging well and supporting you while you're playing soccer. And for my soccer friends, you definitely need to be practicing your cutting drills. So obviously soccer is super dynamic. I know if you're playing on a team, so if you're a younger athlete, you're probably doing this all the time and you're like, I don't even understand why she's saying this. But right now I'm talking to my adults who go and play soccer once a week and who don't really do their drills like they used to when they were kids because they're kind of tired of them, or maybe you just don't have time. But those drills were not just to help you get better, those drills were also to help warm up your muscles. So if you are, let's say, playing soccer as an adult once a week, I want you to do kind of a gentle run warm up. I want you to do some stretching, make sure it's dynamic stretching. And then I want you to do some of those cutting drills. Put your body through the paces a little bit more before the game. That way when you get into the game and you're really focused on what you're doing, your body's prepared for all those different motions. And now for my basketball friends. If you play basketball, it is super important that all the muscles, especially all the big muscles in your legs, are really strong. So I'm talking not just about the quads and the hamstrings and the glutes, definitely talking about the calves, because my basketball players are not just pivot shifting, they're not just going side to side, they're not just sprinting, they're also jumping. And so we want to make sure that our entire lower extremity is really, really strong. So you want to be doing dynamic exercises for your calves, for your quads, for your hamstrings, and definitely for your glutes, to make sure that you are not going to have any injury to those knees. And when I'm talking about that, I also want you to remind you about the glutes that are on the side. So most people, when they think glutes, it's the booty, right? But you also have your gluteus medius, which is on the side of your hip. Now, that is super important for my basketball players because it's such a dynamic. There's so many different activities that are involved in basketball. You really want to make sure that you've got that good, stable support on both sides. So don't forget to do some exercises to strengthen those glute muscles that are on the side. And if you play basketball regularly, we want to make sure that you are practicing those sprints and those pivot shifts. So a lot of times, you've got the ball, you've got one foot planted, the other one's moving around. You want to practice that. Now, I know, again, if you're involved in a league, you probably have practices and you are doing that regularly, and you're saying, why is this lady even saying this? The truth of the matter is, as we get older, when we're playing once or twice a week, we tend to forget the importance of those drills and how they really help to train our body for the activity that we're about to do. So doing the shuttle runs, doing those sprint activities, doing the pivot shifts, and making sure that our body is warmed up for the activity we're about to ask it to do is really, really important. Basketball players need to practice jumping. And again, if you're young, you're probably used to doing this during practice, but if you're older and you just play a pickup game every once in a while, I have seen far too many patients have really challenging issues because they didn't practice jumping, and they, really got into the game and they weren't thinking about it, and things didn't end up going so well. So make sure that you're doing some jumping. It doesn't have to be necessarily huge. It can be little jumps, just really to warm up those muscles to make sure that you don't have any injuries with basketball. There it is, my top recommendations for how to prevent knee injuries based on different sports that you may be doing. If you have any sports that weren't included here but you would like to hear my top tips on those, definitely drop them in the comment box below and we will make a video for you. Have a great day.